Okay, this is for MRI the lumbar spine. This is the side view. This is the frontal view of the spine. This is the vertebral body. I'm sorry, this is the actual segment of the spine. This is the vertebral body. Pedicle, remember that this is an important structure. Transverse process, spinous process, and then you have these handles that go up and down. This is called the superior articular process because it articulates with the inferior process of the vertebral body up top. Okay, so when the superior articular process joins the inferior articular process from top, it forms a facet joint. And that's very important to know. This is the oblique view, vertebral body. You have the pedicle. This is a side view, but if you look from inside, you can see that there's a canal. And this is a spinal canal. The spinal canal is well protected by the bone in the front, the pedicle on the side, and the posterior spinal structure on the back. And this is the spinal process. If you look at the superior articulating facet or process, you can see that this is a groove which forms a joint with the inferior articular process of another level. You see the transverse process there. Of these structures, vertebral body is important to remember. The facet joint, which is formed by superior and inferior articular processes, are important. The pedicle is important, spinal canal is important. Yeah, looking from the back, you have the spinal canal that goes down, transverse process, inferior process. I'm sorry, spinous process, transverse process, superior articulating process, inferior articulating process. I want you to pay attention to this little groove right here. This is what you call the pars interarticularis. Patients can have either a defect or fracture that has healed up in this area. Because of the frequent bending, stooping, extending of the spine, the gymnasts, especially teenage gymnasts, have high incidence of pars fracture. I think 17-18% of them suffer from that. If both sides fracture at this level, if you look at it, if you cut this area right here, what it does is it separates this element from the front element, and they're not connected anymore, right? So it's like cutting right here on both sides. Okay, so this whole posterior element becomes detached from the front element, and so the front can just slide forward in a condition called spondylolisthesis. Listhesis means to slip over. The pars interarticularis defect or fracture is called spondylolysis. Lysis means to cut. It just means cut spine. You're basically cutting the vertebral structure in half by and resulting in dissociation of the posterior elements to the middle and the interior elements. This is a top view, again, vertebral body. See the end plate, the depression on top. This is where the disc sits, okay? And the disc can herniate back this way, or it can actually herniate through the end plate. And some authors believe that herniation through the end plate is more common. This is side view. So let's look at the structures again. What is this going to the side? This is a transverse process. And then this is the spinous process. This is the superior articulating process. And then this is the pedicle, the thick middle part that contains, that are the side pillars of the spinal canal. This is the actual view of the MRI. This is a side view, okay? This is called a sagittal view. Let's just look at the numbering. The very first vertebral body is actually C2 because the C1 is a circular bone, and the side on a side view, the first vertebral body is you're going to see C2, and then you number it to C7, and then you go down to T1 all the way to T12, and then it's L1, 2, 3, 4, 5, and then you have the S1. The numbering can get a little bit confusing when we add the transitional segments. Sometimes you'll see L4 or missing L5, and then sometimes you'll see an extra L6, but we all have the same number of nerves, although we can have different segmentation of the vertebral body depending on whether or not the sacrum has fully formed or partially formed or what have you. Okay, but for now, remember the lowest part of the lumbar spine is the L5, and the discs are numbered by level above and below. So this disc is named L5-S1 disc. The one above is named L4-L5 disc. Okay, and this is an axial cut. Axial view is simply looking at from the bottom to top. Remember, this picture is looking from side, and axial cut is looking from the bottom up. So this plane right here, this plane. And so if we cut through this particular disc, what do we get? This is a picture that we get. Okay, so if you're looking from the feet, you got feet sticking out like this, and you're looking up into it, what you're going to see are the pelvic bone on the side, because this is way down in the pelvis. Usually when you palpate the sides of the top of the pelvic bone on the hip on an individual, that usually corresponds to the L4 level. And so this is the L4 level, this is L4, L5, so the L4-5 disc. We're cutting through the disc right here. And so you got the pelvic bone. What is this? Spinous process. This is the transverse process. You're catching the bone a little bit. Now this is color, but you're not going to see color on regular MRI. The important structures are what? This is either the vertebral body or the disc, right? So if you keep going up, you'll see bone and then disc, bone, disc, because we're moving the slices up, right? But let's, since we're seeing the foramen on the side, this is the disc. But the important things to look at are the facet joints in the back. Remember, if we add the superior articulating process to the inferior articulating process, you end up with a facet joint, okay, one on each side. And you have the spinal canal where the nerves are going down, and the nerves, let me explain the spinal cord. We have the brain, and you have the spinal cord that comes down like this, and the spinal cord actually ends anywhere from T12 to sometimes L2 level, right around here, and it turns into a horsetail called cauda equina. Cauda means the end or tail, right? And equina is horse. So this turns into horsetail, a bunch of noodles or strands of nerves inside the canal. And as the nerves come down, they'll exit at each level, one at a time, okay? And those nerves are named or numbered by the level that they exit. So if they exit by L4, it's called an L4 nerve. If it exits by L5, then it's called the L5 nerve. So if this is the L4 vertebral, L4-5 or disc, or L4 is just below the L4 vertebral body. The exiting nerve, which you see yellow structure here, again it's black and white. They colored this so you can see it. This would be the L4 nerve that's exiting. The next one is getting ready to exit. So I want you to think of this like a highway. The nerves have to exit, so when they get ready to exit, they will get into what? The exit lane. off to the side. I'll explain that a little bit later. And the exit lane, it hugs the facet joint and the pedicle, which is going to be located here. And then next level, it'll go down, go exit. So this is the L4, and these two structures right here is going to be L5 nerves that are getting ready to exit at the next level as it goes down. Okay, and so if you have a herniated disc, and the only area that we're really concerned about when we're looking at the MRI is the posterior margin of the disc, the condition of the facet joint, because you'll see arthritis, or sometimes you'll see a synovial cyst. The joint is a true joint, so you can have a synovial cyst outpushing of the joint with the fluid and can cause compression, irritation, impingement of the nerve that's right by it, as you can see. So we want to look at the condition of the facet joint. This is a what we call ligamentum flavum. There are three or four basic strong ligaments that support the entire spinal structure that runs up and down. So you have one ligament that covers the anterior longitudinal ligament that covers the entire vertebral body in the front side, and then you have the posterior longitudinal ligament, very thick ligament that covers the posterior part of the vertebral body, and then you have the ligamentum flavum that covers the back side of the canal like this all the way down, and that's what you're looking at right here. They can become thickened with degeneration. Actually, some authors believe that it doesn't thicken, but it just buckles because kind of things start sagging and then they buckle and they can crowd out this space to the spinal canal. So we want to look at the size of the spinal canal, and there's some measurements that show how severely stenosed or narrowed. As you can imagine, if the spinal canal narrows, there's less room for these nerves to breathe and function, so they can cause compression, irritation. It's called spinal stenosis. The narrowing of the canal can be caused by degeneration of the spine or herniation of the spine, right? If you have a huge herniated disc that comes out like this, then it'll crowd out the spinal canal and cause entrapment of all the nerves, right? Obviously, if it herniates out huge, which occurs rarely, but it happens, you end up with cauda equina syndrome. It's basically a paralysis. All the nerves are dead. You lose bowel bladder function. You become paralyzed from whichever level below. It's rather rare to have herniated disc cause that, because if you look at the spinal canal, it's quite capacious down here. And most of the herniation occur at L5-1, L4-5, and sometimes up at these levels, simply because most of the flexion, extension occurs at the bottom levels, okay? And flexion, extension is what causes uh, pressure on these nerves in an abnormal way so that the disc can be damaged and herniate. The spinal canal stenosis can occur from thickening of the ligament or degeneration of the facet joints. What happens when the joints degenerate? They hypertrophy, they get larger, the synovial lining gets swollen, and this entire facet joints can become thicker and then cause narrowing of the canal. The disc themselves can degenerate, and so what happens when the disc degenerates? They can collapse, they can lose the water content, become thinner than its normal height, and also the backside of the end plates in the vertebral body, they can grow osteophytes. Osteophytes can grow out, and so the vertebral body gets thickened, so the entire canal narrows, and you have spinal stenosis. Okay, so uh, let's go to the next slide. You see the side view, and I wanted to show the foramen. Okay, this is the vertebral body, the pedicle through the middle here, and then you have the transverse process that's sticking out at you. You have the superior articulating process here, and the inferior articulating process and spinous process. And this is the hole where the nerve is going out. This is the hole right here where the nerve is going out. This is a side view. This is a bottom view, looking to top. And so the hole can become narrowed. Remember I just talked about narrowing of the spinal canal or the central canal. The holes on the side can be narrowed where the nerve is going out. So if this hole is narrowed, it will cause impingement of the exiting nerve, in this case L4 nerve, right? But let's think of a scenario where this hole can be narrowed. If the disc is narrowed because of degeneration, if this disc is not as thick as a normal disc, then the entire roof can collapse, so it can be smaller. If the facet joint becomes arthritic right here, look at the hole, the roof of the hole is formed by the facet joint, and they can cause narrowing of the hole. The osteophytes I talked about, the vertebral body, can cause growth of the bone, and the discs can become thickened. Or you can actually have a herniated disc that comes out here called foraminal herniated disc. Disc herniation can occur through the middle. Disc herniation can occur to the paracentral region. Disc herniation can occur into the hole. Disc herniation can occur to laterally outside the hole called extraforamen. Okay, so let's explain this concept. This is the L4 vertebral body. This is the pedicle down here. This is the L5. L4 nerve exits below the L4 vertebral body. Okay. L5 nerve exits below the L5 vertebral body. So when you have a herniated disc in the middle, it can get both the L5 nerves that are going off to the sides, but it does not get the L4 nerve that's already exiting. Likewise, for what we call paracentral disc herniation, which is the most common place of disc herniation, it can get the descending L5 nerve, but not the exiting L4 nerve. We're talking about disc herniation L4 and S5, and applies to every level. But if you have foraminal disc herniation, the herniated disc is in the foramen, then what will it get? It will get the exiting L4 nerve, but not the descending L5 nerve, okay? This is going to be confusing, but it takes a little bit of learning. And so when we look at the spinal canal, this is the frontal view. You got the pedicles, you got the vertebral body, you have the intervertebral disc. You can divide the region into 4 different distinct sections. The middle part is the central canal. Look at this section B, it's called the lateral recess. Recess just means a little bit of space, right? Lateral recess, there's a little bit of space right here. Think of this as a main highway. As the nerves are going down and they're saying, boy, I got to get out of this highway because I'm ready to exit. What do you do when you're ready to exit? You get on the exiting lane, and you put on your turn signal, you get off to the side lane, and you get onto the exiting lane. That's the lateral recess, and that lane hugs the pedicle right here. Oh, you see that? Okay, it's called lateral recess. You can have lateral recess stenosis. Okay, this area can become narrowed. And as you exit, you're out of the highway. You're actually in the exit, making the turn. This is the foramen. So this is the foramen, and we talked about the foramen becoming narrowed, right? So that's called foraminal stenosis. Once you're out of the foramen, outside the spinal canal and the entire vertebral body, it's called extraforaminal region or lateral region, okay? So, and if you look at the axial view, of the MRI. This is looking at from the front or from the back. So you have the central canal, okay? Remember, this is the L4 vertebral body. This is L4-5 disc. The one above is L3-4 disc. The L5 vertebral body would be down here. Through the middle, you have the L5 nerve going. L4 nerve is exiting, so it's in the exiting lane. And this is the exit, and this is outside the exit, okay? So when we look at cross-section or the axial cut right through here, we're going to cut it right here and then look from the bottom up. Eyeballs are sitting down here and looking up into it, the axial cut, all right? What are we going to see? We're going to be looking at this disc from bottom up, right? We're looking at this disc bottom up, right? We're looking at this foramen from the bottom up, so it's going to open up, and that's this section right here. And you have the spinal canal, okay? You have the facet joints on the side, spinous process sticking out. What happens when you have a herniated disc through the middle and the side? It gets the L5 nerve root that's exiting down, right? It doesn't get the L4 nerve root, which is already exiting, unless you have foraminal disc, okay? So this is the foraminal disc that's getting the exiting nerve. This is what an MRI looks like and the side view, okay? That's enough for this recording. We'll go to the next one.